All right, we are live. Hey, everybody, this is Dr. Michael Kaye from the Center for Functional Health, and I'm so glad and honored to have with me tonight Eileen, Arenz, Cuce, and we're going to talk about how to get healthy and how to optimize health. So, welcome to the show. It's great to have you on. I can't wait to speak to you. I have lots of questions, and I can't wait to learn about the work that you do. So, welcome.
Thank you so much, Dr. Kaye, for having me today. And I'm here to answer any questions you or your viewers want to pose about my practice and what I do, and or more specific to diagnoses, etc. I'm open to it all.
Great. So let's dive into it. So the big question is, everybody has their health journey and we have our passion journey. So how did you end up here? How did you end up doing the work that you do currently?
Well, I guess I have my parents to thank for the original interest. It was just I grew up in a home where there was organic gardening magazines around on the coffee table, and Dr. Andrew Weil, who I think he still looks identical to how he did when I was, a little child, and I'm about to be 53. So it's amazing. So my parents were always looking into alternative ways of doing things. My mom was an RN, and in the 70s, she still took us to chiropractors and, herbalists. When we would get tonsillitis or something, they would paint some herbs on the back of on our tonsils, that kind of thing. So the first instance I probably had of, oh, well, you can do something different than just what the protocol is of, removing a body part because you have an itis of it was, my younger sister was 3 and she got constant tonsillitis. And so my mother took her to one of the places where she went, where there were chiropractors and naturopaths and that type of thing. And they suggested that we stop with cow's milk and no sugar. And that would be a start for my sister with her recurrent tonsillitis. So we got a goat, even though we lived in town, but zoning was a bit different in the 70s, I suppose. Yep. So we lived on a 1/3 of an acre lot, and my parents got a goat. They milked it, and we learned how to milk the goat too. I was age 4 at this time. My sister was 3. And she never got tonsillitis again. So that was kind of a cool opening. And then every time, my mom would have questions, then she would do things alternatively for us. So fast forward, my son was diagnosed with type 1 diabetes, and my daughter celiac, and then me with Hashimoto's. And all of these autoimmune cases happened within a year and a half to 2 years after my father died suddenly in a fire. So it was interesting because then I really got interested in how does inflammation really manifest in the body, and what does that look like? It looks different in different people, but we all had an autoimmune illness and it was all different. So, learning how to care for us and the diagnoses and be well. And now my type 1 son, he needs insulin to live, as the type 1s do when they're diagnosed when they're tiny. But my daughter is a healthy, vibrant woman, and she eats a gluten-free diet. And then I am free of symptoms. I would say I don't have Hashimoto's, although my doctor, who cared for me years ago, when I told her that I'd stopped taking the Synthroid and that I was doing some protocols, and I got blood work done, everything was fine. And so she said, well, you always will have Hashimoto's. I said, okay, well, I'm happy to say that, okay, if I have Hashimoto's, I am symptom-free. My labs are normal. So call that what you want to call it. But so I'm healed of that as well. So just every time something sprang up with one of my kids, that was kind of an opening into, oh, I'm going to look into this and add this. And I wasn't practicing back when my children and I were diagnosed. That was before I went to school for Chinese medicine and everything else I studied. But then once I started my practice, it seemed like, my kids all had Lyme disease, but one had the chronic Lyme. So the 3 of them were fine with the normal protocols that they put them on, the doxy for the 3 weeks, and et cetera, et cetera. And then I could support afterwards with the herbal strategies that I employed. But my one son, the type 1 diabetic, again, he has chronic Lyme. So when it flares up, then he has to pay attention to those things and basically keeping his body healthy so it doesn't express. And I also had an interesting situation when I was like college age, a woman who I was a nanny for, was really into macrobiotics because she had cancer. She had 3 small children. And that I embraced that for quite a while. And I really think that's why my son with the diabetes is so healthy, is I just cooked macrobiotically. And for your viewers who may not know what that is, it's a diet from the East. It's actually a lifestyle. So it's a way of looking at things, a way of keeping your home, a way of being in, having good relationships at all times with people as best you can. And it's a balancing protocol, basically, but it includes diet. And a lot of times here in the States or in the West, we kind of look more at like just the diet. We don't look at the other lifestyle components, but that's something that I really, really value. And sometimes it's more important than actually what the person is ingesting if they're in a toxic environment or, a relationship that's not healthy. So that's how I got into this. And I guess I'm just a student, a junkie of being a student, because once I started studying, I just couldn't stop. So I studied. First, I became a clinical nutritionist, and then I started to study Chinese medicine. So I was a Chinese herbalist first. Then I went back to school to get my master clinical herbalist cert so I could work with patients, with the doctors, with complex protocols, and mix my herbs with the complicated medical protocols. So I know all the science of the herbs that I'm using, and I can comfortably use that with anything that's in place in a Western protocol. And then I went back and studied bodywork. So I'm a craniosacral therapist, a polarity therapist, and Reiki master. And a newer adjunct that I use is I practice family systems therapy. So that can get to the bottom of family constellations, it's sometimes called. That can get to the bottom of unhealthy family patterns that we've inherited and family traumas that get handed down through the line and can sometimes be a cause for kind of an odd diagnosis, or we can't figure out what the missing piece is. Sometimes the work is in there. So I think that covers about all of the modalities, if you will, of what I practice here.
Yeah, no, that was great. So, a bunch of questions come to mind. So I want to talk about herbs.
Sure.
I want to talk about the family trauma, the family systems thing. So we find, like in my practice, a lot of times we can be treating somebody with a gastrointestinal dysfunction. They're doing all the right things. They're eating the right foods. Maybe they're following a low FODMAP. They're working on meditation, and something's just not moving the health needle forward. And we dig a little bit deeper, and we find that there's this trauma that was never really addressed. So my question to you is, do you feel that a trauma can bring out an autoimmune presentation? And it seems that way when we see it in practice. Like when we do that history, we go back and you kind of can see that timeline where it's like some type of trauma happened and this autoimmune presentation came out. Do you see that in your practice as well?
Yes, all the time.
Okay.
And my question is, if someone shows up with, a big diagnosis, let's say either an autoimmune or cancer or, MS, anything, my biggest question is, what was going on in your world a year and a half to 2 years ago? Because I find that that's usually about the amount of time after the adrenaline stops pumping from whatever it is that was going on, that the body then it kind of comes to a head. And then that's when we see the symptoms or the official diagnosis happen. So yes, I think that is an integral part.
And it's interesting because we'll see, and I'm sure you see the same, like, there's one autoimmune presentation, and then there's always this proclivity, not always, but this, chance of another autoimmune backing up, a year, 2 years, 3 years afterwards as well.
Yes, absolutely. And so with autoimmunity too, what I'm doing, or with any person really, is I'm trying to make them, so, from the acidity to the alkaline, right? And if we push you to the alkaline state, that's the state where we see the cessation of symptoms, and so as much as we can move to that side, then that's what I want to see. And that's where it depends on the person. And we, what I listen, what do we need to do? Do we need to do more meditation? Is the diet pretty clean? Maybe actually the properties of the foods are different for one person that need to be, for another person with the same exact diagnosis. So practicing from a Chinese medicine perspective, all foods have taste properties and temperature properties. So if you have two people, let's use Hashimoto's, for example, in front of me, they may get different protocols according to what is going on inside of their body, because it's all about balancing so we don't see the symptoms anymore. That makes
Gotcha.
sense. Yeah.
Yep, very much so. So, I know you use herbs. I do not use herbs in my practice. And you're a master clinical herbalist. So, can you talk about that title, that certification? Why is that so important? Why is that better or different than another kind of herbalist certification? Like, how do we know, as the general public, customer, patient, consumer, how do we know who we're going to? What do we look for?
That's a really, really good question, because there's a huge difference in the knowledge base of herbalists. Some people may be, and when I was in school, you'd have this. Some people were like kitchen herbalists, and they go out in their gardens and they would grow just medicinal plants that they would use maybe for their families. And then there's other herbs that I don't do any gardening or any prepping of the herbs. I get everything. It comes and I mix up tinctures at my office, because I don't have the time to preserve them or anything like that. But so somebody like me, the program that I went through was a 500-hour program. I went for 2 years, and we had to have college chemistry and physiology and anatomy before we could get into the course. And so he required much more knowledge to begin with. And then for every herb that I work with, I have a Materia Medica book, which is a sheet of information on every single herb. It has the chemistry, and then it has, which that's what the doctors are more interested in. But people, if they're into Chinese medicine or something like that, it has on it what the classifications are in Chinese and the Latin and the terms, and then the energies, which herbalists, we use that. So, but the chemistry of the herbs, knowing that, is what sets me apart from someone else who hasn't had a scientific program. And that's where if I'm working with the patient and they say, okay, I'm going to tell the doctor, what you're recommending, then I always want to communicate with the doctor, and I can send the doctor the Materia Medica sheets from my notes so that they can see exactly that there won't be any contraindications with what they're using. Because that has been a problem historically, is, doctors will just say, well, you can't mix herbs with the chemo, or you can't mix herbs with this med. And while that's true that you cannot mix certain ones, there are a slew of others that we could pick. So when I know the medications, then I am very carefully writing formulas and mixing them to accommodate each patient's needs.
Gotcha. Yeah, speaking with a colleague of mine who's an oncologist, we're talking about, when getting chemo, I said, it wouldn't be great to have some support on a cellular level. He said, the problem is you're going to give support on a cellular level. We're trying to do chemo and try to get the cells that are bad, that are grown, try to, crush them, but you're giving something to support them. And it can't really separate between the good and the bad. And that's why he really wasn't very much into, supporting with vitamins or supplements. But I can see where herbs can make a different kind of connection on a cellular level to kind of actually support when somebody's going through chemo. So is there a concern when they're doing chemo? Like, is there certain ones like, hey, they should not be using this at all? I mean, does that come up a lot?
Herbs? Not really herbs so much. Yeah, vitamin supplements sometimes, but I really deal with all herbs. I have a little shop where I sell supplements now. That's it's a new part of my practice.
Mm-hmm.
But the herbs themselves, and it's actually the class of herbs that support a cancer patient are called Fu Zheng, Fuzheng, and these are all the herbs that we get into the patient's system as soon as we find out. So if somebody says to me, I'm starting chemo in 2 weeks, I'll say, great, let's get that in you. Let's start tomorrow. And we'll get that in to start to strengthen the body. So then you won't see the symptoms of fatigue or the cachexia, or we won't see them, maybe the hair loss, that kind of thing. So the quicker we can get in to support them, the better. And they are not contraindicated with chemotherapy. And that's another thing that I have. All of my herbs have research and studies, and that's right in there in my Materia Medica, which I gladly share with any of the physicians who are interested in that info.
Gotcha. Because I know some of the conventional docs I work with, because I work with a bunch of conventional docs. I mean, they're all good folks.
Sure.
They would be concerned about, using herbs. They're always, because
Mhm.
obviously they don't know it like you know it. I don't know much about herbs and stuff. So, they're very worried about that, and they're worried about what it's going to do to the body. So, especially if somebody has cancer. I mean, I doubt that it could accelerate the cancer by any means, right? So when you're looking at them and managing them, you're managing them from the position of I'm going to help them with the side effects of chemo as well as addressing the current cancer.
Yes. So yes, we can do both, and whatever else the person has. So as I was saying, there's in Chinese medicine, we look at a person's constitution. And so I could have 4 people before me, all, let's say, with lung cancer. And one could have a hot, damp constitution. One could have a cold, dry. One could have a dry, damp. So, or a dry, cool. So everybody would get different foods that would be best for them, that would balance them, and different herbs. So it's very, very individualized, the work that we do as Chinese medicine practitioners, because it's about balancing. And the reason that we have some kind of diagnosis, anything at all really, is because there's imbalance in the body. So you could look at something that's really benign, like let's say, headaches. So there's an imbalance. The body is talking and calling out. And so we, unfortunately, in the West, we tend to not listen to the whispers of the body. And we don't treat it when it's at a whisper stage. That's when the body's just, hey, a little out of balance. And at that point, it could just mean you need a little more sleep or a little more water, but we instead, if we're getting, let's say, headaches, like we were going with that, and then, they become worse, or we get them more often. So now the body's not whispering. It's begun to chatter loudly. And then it will scream at you. And normally when the body screams, we start to pay attention here in the West, but then it's a big diagnosis at that point. And so the normalization, I think, of things that shouldn't be, like headaches or, issues with the menses or digestive issues, is to our detriment in the long run. We normalize and say, oh, that's just, it's just part of being in America. You're tired. Well, it's also part of being in America is being sick. So I try to get people to really listen to their bodies so that we can treat it at a whisper stage. So with something like, cancer, a lot of times when we look back and we see, okay, and people will say, oh, I was really healthy until I got the cancer diagnosis. We look back and they've had all kinds of things for years, but there are things that are normal in America. And there's one thing that I would like to do, is to educate people on when the body whispers, pay attention. It's a call for it to be balanced at that moment. And herbs can help with that, and diet and body work, all of those things.
It's like in practice when we say to patients, do you get headaches? They go, oh, only the normal headaches. I mean, there's no normal headache, right?
Yes. Or they'll say, well, just like when you're hungry. And then I said, well,
right.
that's a toxic hunger headache.
Right. So, but again, they're not listening to those whispers, right? That, hey, when I get up to the top of the steps, I'm a little bit more winded than normal. Oh, so I must be getting older, right? All those little things that change. Oh, my belt's a little bit tighter, stuff like that. That's fantastic. You're not listening to those whispers, like you say. So my question, again, staying on the same thread, is, can you explain to everybody, like, when we see like herbs on Amazon, like, we're not buying a concoction online, and why that's important to stay away from it, because you may never know what that's going to be like if it's third-party tests. Like, most of all the vitamin supplements companies that I use are all third-party testing their products, right? So we're not running the general run-of-the-mill 3-letter organization companies where we get the supplements from, right? So can you talk a little bit about why it's important to kind of, refrain, although it seems good that here's this bundle of herbs that you can buy off of Amazon, and why you really want to be with a professional? What can go wrong?
Well, first of all, what I was saying, in the beginning, you want to know that you can take the herbs you're taking with any medication you're taking. So that's an important thing. You need to know the side effects. And then also, there's somebody will say something like, oh, ginger is good for digestion.
Right.
Well, it's actually good for digestion if you have a cold digestive system. If you have a hot one in Chinese medicine, you don't want ginger. So, there's the different properties come into play. Or, so if you're having issues with digestion that you think ginger is going to heal, and it's like a IBS or something, there's way more that needs to come into play than just a one single herb. And when we think we can cure things with one herb or one vitamin pill or one anything, I think that's a big mistake. So a lot of times, herbs will get a label for, okay, St. John's wort is a perfect one. That's the depression herb, right? It's a depression herb.
Mm-hmm.
It actually has lots and lots of uses, but I never use it by itself. So, it's good for nerve pain in folks, and it's good for seasonal depression. It's really good, but coupled with another one, lemon balm, then that's really good. By itself, its efficacy is nominal at best. So, I think it's knowing how to pair them and knowing that the synergy of the plant sometimes is where the medicine is. So like I just mentioned for seasonal depression, if you took St. John's wort, you might not notice much of a difference if you took it by itself, but mix it with lemon balm and that's really good medicine. But that's something that, it's not really out in popular information, that kind of thing. So getting someone who's trained that way is important. And then, so it's not mixed with the side effects, like we were saying, of any medications that won't be contraindicated in that case. And then amounts. So that's the thing too. I have certain herbs that I use that you can only use a tiny little bit. Now, most of the time they don't sell those particular ones in tinctures in health food stores. So, they're so-called toxic herbs, because if you get much more, it's just a tiny little bit that I'll put in a formula. But I know how much that is, but someone else may get it. And I saw some of those tincture bottles in the health food stores are not labeled. They might say, 15 drops. I've seen some brands that don't even have a dosing on it. So how would a person know? And certain ones that are like lymph moving and stuff can really cause you, to be very nauseous and not feel well. So that's something, knowing how much you can take of an herb. And then, there's a lot of misinformation that makes people scared about herbs too, I feel like I should mention. So when people warn about herbs in general, they're usually talking about it in the general herbs that most people can get their hands on. They're usually talking about isolates of an herb. And that's not how I practice. I practice whole herbs. So I put in my tinctures that there's a whole herb, or in my teas are the whole herb. So sometimes like they'll say, let's use curcumin, because that's very well known. And I do use that as an isolate for a lot of people for pain. It's wonderful. Mm-hmm. But curcumin, it's an isolate of turmeric for anybody who's watching and is not familiar. So if you have large doses of curcumin on certain presentations, they can have gastric distress. And so people might not know that if it's curcumin is not a whole herb. And then they'll say, oh, turmeric. I've had people tell me turmeric causes gastric distress. Like, it's usually when you're getting it in the curcumin, then it's the isolate. You can get so much more in a dose, and they put it in a pill. When I'm putting it in a tincture and a formula, I'm using the whole herb form. So that's something too that I think people have to watch out for is, if they take the isolates of, or another one that's common, milk thistle.
Yep.
So Silmarin is, and a lot of people use it for liver detox, works great, but the constituents of an herb are not the whole herb. And usually when there's studies that are being done, they're saying, watch out for this herb. It's not the whole herb that is being ingested in these studies, just to, because people get so scared of herbs. So I just wanted to mention that.
Yep, they do, and like I said, some of the conventional docs do as well, right? Because they feel sometimes it's just not well studied, and they just
Mm-hmm.
or they just don't understand it.
Mm-hmm.
And we have a lot of men in our practice who, well, I need prostate health, so they start taking milk thistle and saw palmetto and pumpkin seed. They're just throwing the kitchen sink at it, hoping for the best.
Yeah.
Mm-hmm. So I think it's important to sit with somebody like yourself that really understands how we can best use these to our advantage and efficacy. And that's really important.
Yeah. And here's the thing. I was trained in both when I studied Chinese medicine and in herbal school. We are treating the patient. I am not treating chemotherapy. I'm not treating cancer. I'm not treating Hashimoto's. I'm treating the patient. So when we look at each person, yes, while they may have the blood work there that says, yes, they have Hashimoto's, or yes, they have MS or whatever it is, I'm looking inside and I'm saying, okay, what else is going on? Because I can probably throw herbs in there that would help the MS symptoms as well as, oh, look, we're constipated. So when I originally meet with people, it's a 1-hour meeting to get an intake on everything that's going on, not just their chief complaint. I need to know everything. I even ask them what they do in a day in their life. So I'm understanding their lifestyle. I might hear some stressors in there. I usually ask for the biggest stressor in people's lives, but learning everything I can about a person so I can get a healing protocol for them, not necessarily the Hashimoto's. Yes, we're going to eradicate the symptoms of that when we do care for the patient like that, but it is very individualized. So it's the patient that we're caring for.
Right. Treating the patient, not the diagnosis, and not the lab report either, right? So, I mean,
Yes.
that's something else we take a look at. But I'm sure you've seen like where you've treated somebody and you can see the proof in the lab work, right? You see the,
Yes.
TSH change, you can see maybe the
Yes.
cholesterol change, HSCRP, whatever it is, you can still say scientifically, hey, we still move the needle forward, right? So,
Yes, I love that. I love when we can do all those things. And now I'm seeing that most people have insurance. For a little while, years back, when I first went into practice, not as many people were insured.
right.
So, if people say, oh, I don't have the lab work, that's fine. I'll go on what I see from their tongue and their pulses and what they're telling me. And we're treating the patient once again. And it can look like, it's a thyroid disorder or whatever, but I wouldn't know and have that confirmed by anybody. But we are treating the person with the symptom patterns, and that it works. But it is much nicer now that, we're seeing there's a rise in people with health insurance, or at least that's what I see. So
Yeah. Yep. And if not, we can get blood work cheaper now than we ever could, to be honest with you, even if they had to pay cash. So it's really great that that's out there for everyone. So staying with the thyroid, let's talk about how many times or how often do you see, like in your practice, where there's thyroid dysfunction and there's gut dysfunction?
all the time. Yeah, and that's where when people say to me, I think I have leaky gut, and I'm like, yeah, you and most every other
Right.
American,
Right.
you
Yeah,
know.
no doubt. Right.
Yeah. So, and that's something, yeah, we definitely have to see what's going on in the gut. And that's, like I said, I ask for every single aspect of the person's, health. That's a big part of it. Sure.
Gotcha. And on your website, you say that you do look at digestive disorders and you also use the term failure to thrive. So can you talk a little bit about that presentation, failure to thrive? Because I think a lot of people may not know what that means.
Okay, sure. So, yeah, I've had a bunch of they're usually kiddos, smaller kids, but then we see that same pattern in adults, and some of them actually are when they're, it's the same Chinese pattern when they're undergoing chemotherapy, that we see that failure to thrive, and we're treating the same organ system from a Chinese aspect. But in the children, it's where you see there's not a lot of muscle tone. They're not gaining weight, except for their abdomens are usually distended. They complain after they eat. And a lot of these kids, I actually have gotten a lot of kids straight out of CHOP that the parent, it doesn't make sense what, the gastroenterologist is saying down there to them. And they're not checking into it to see if the child might have a gluten issue, or, I actually had a couple of them say that the doctor said to go down to the McDonald's on site at the CHOP and fill them up with, French fries and a Big Mac and a milkshake, and that would put the weight on them. So, which if you have celiac, that would actually make it go through you even quicker, and you're not going to absorb anything because the intestines are in no shape to absorb at that moment. So, yeah. So failure to thrive is just that. It's basically when we're looking and a lot of times with the kids, you'll see like the dark circles under the eyes, which means there's some adrenal involvement at that moment also. And they look pale and wan and sickly. So, but it's a classic, like you look and there's not a lot of muscle tone in the arms and or legs.
Gotcha. And then you get hold of that, and usually, is that coming from a pediatrician? Does the pediatrician send over to you, or just more mom and dad that are just so concerned because the needle's not being moved forward?
That's exactly right. Yeah. So I have a few physicians. I have more than a few. I have physicians that do recommend their patients come to me, but more often I am word of mouth, and a lot of people, say, "Oh, I, heard about you from wherever in the community," and I used to have an office in New York City up before the shutdown. So now I'm
Mhm.
100% in the Lehigh Valley. But so I have people from up there, and there's little pockets, that'll get to know you throughout the nation that I have. But most typically it's word of mouth that I get my business.
Okay.
And yeah, because a lot of the time, yeah, I don't know, they don't look at the, like, with a failure to thrive, I would do body work on that child. And people
Mhm.
would say, like, and I've had the smallest child I ever worked on was a 9-day-old baby, and that
Wow.
baby had reflux and nonstop reflux. So there's definitely inflammation there. And then I talked to mom, and here, she carried the baby during the pandemic under tremendous amount of stress, not even knowing could she give birth with her partner in the hospital. All of these things. What kind of a world is this baby coming into the world in? And so, I think the baby absorbed a lot of that stress. So when we unwind the baby's nervous system, then the baby then didn't have those symptoms anymore. And the younger they are, they absorb body work like magnets. It's
Hmm.
amazing.
Well, I don't think there's anything blocking them, right? So
No, they don't think there's
that's
anything
why.
weird about a
Right.
woman touching them. Like just very lightly touching them, and yeah,
Yeah.
exactly. No, they're just sponges. It's almost like you feel your hands being sucked into
Yeah.
this. So cool. Yeah.
They're ready to accept. So it's really.
Absolutely. Yeah, it's cool.
Yeah. So staying on the thread of digestion, we'll often have people come in and they said, well, I tried low FODMAP, it didn't work. I went gluten free and it didn't work. And I always ask when they're gluten free, they're never really gluten free. They're kind of gluten free. When keto, I have a lot of women that come in, they've gone keto and it
Mhm.
did not work out well. Right. So really just messed with their hormones. They couldn't sleep at night. They didn't get to lose the weight. So we see a lot of these different digestive disorders that come in from SIBO and SIFO and constipation, diarrhea, and again, it's like that back to normal headache. Well, I always had constipation, and they shrug it off. So I mean, if we can turn our attention to the importance of daily bowel movements. Last week, I interviewed Tracy Piper, the Piper Protocol, and she is a colon therapist. And we learned a lot about the importance of, why you need to go every day, why you should even look at colon therapy
Mhm.
as well, how that's really important. So,
Mhm.
from your perspective and the use of herbs and nutrition, can you talk about the typical IBSD, IBSC, that my stomach is bloated, I'm constipated, and now I got diarrhea. And some people are constipated and have diarrhea at the same time. And people think,
Mhm.
oh, that can't happen, but
Yes.
we see it in our practices.
So I think that the interesting question here with the IBS, whether it's C or D, is what is doing the I. So for people that don't know the acronym, it's irritable bowel syndrome. So is IBS. And then the C or the D is constipation or diarrhea, and how that shows up. And as Dr. Kaye mentioned, that flip-flops in some folks. So what's doing the I is usually some food, right? And Americans, we horrendous diets. That's the standard American diet. The acronym is aptly SAD. So, we know right then and there, like, if we look at what people are eating, and even people that think that they're eating a good diet, unfortunately, usually when we sift through it, there are so many infractors there.
Mhm.
But I also go deeper than that, because I always say that, I have some people that have very sensitized systems. I actually have most of the people I work with, I would say, have very sensitized systems. So, like, they're highly sensitive in the world. So they're going to react when they have a little bit of gluten or sugar or whatever it is that they react to, or something you talked about, FODMAP. So, they have a little bit and it just throws their body off. But for me, the better question is, okay, why can't we have a little bit? And if we talk about FODMAP, there's a lot of whole foods on that diet.
Right.
Right. So the question is, why is the body so acidic or so on high alert that it is sending out a message that these foods are dangerous? And so for me, when I work on the body with body work and I damp down the nervous system, then we see that we don't have those reactions anymore. That's really an important piece, because with the eye, as I said, what's doing the irritating, there's usually nervous system involved. Usually always, I should say, from my past experience, I can't ever say a definitive, because that's not very scientific, but I have never seen anyone with digestive complaints that are chronic that doesn't have something going on with the nervous system. And I kind of draw this little, and when I teach classes, so I'll just, so this would be right here. Let's say this is the nervous system. It's the foundation of your health. And so if we are right here, just like that, relaxing, like we're lying in a swimming pool, just lying, floating, that would be relaxing. And our nervous system would be fine. It wouldn't be overreacting. Most of us, though, we have these little, okay, oh, and then it's, oh, got to go, oh, I have that, oh, phone call. And then we have the big, got the phone call in the middle of the night. What's that? Oh, it was something traumatic. And then a little piece of us stays up in that, so our nervous system is on high alert so often. So what happens is when the nervous system is like that, the immune system sits right on top of the nervous system. So the nervous system's bumping on it. And at that moment, then the immune system either underreacts or overreacts. And sometimes both ways. So that's when we see, overreaction example for foods, you'd see hives and you'd see all kinds of rashes and, that kind of thing. Or underreaction, obviously, then the body is not being able to fight viruses and pathogens and things like that, or cancers. So basically what I always say is healing can be simpler sometimes than we think if we address the nervous system. And that's why it's just such an important part of what I do. And also having people look at their world differently. So I do a lot with, changing thought patterns and stuff like that as well.
Yeah, I always think, IBC, irritable bowel syndrome, constipation, diarrhea, we call it, IBS-D, IBS-C. And I think there should be like, a V for the vagus nerve, right? For the system, right?
Yeah.
We find like, we can do all the right things nutritionally, but if we never address that vagus nerve, that nervous system, then we can't seem to move that needle forward. Mm-hmm. However, I find sometimes, and if you can talk to this, please, like in the beginning, I just need some type of physiological buy-in to get them to feel better so we can then see the possibility and the real fact that we got to concentrate on the vagus nerve.
Mm-hmm.
So do you see that in yours as well?
I do. And it's interesting. Sometimes I will, so back on the body work again, sometimes body work, so it expands. So the breath of life contracts and expands when we breathe, and you think about that. So when we've contracted from that phone call or that trauma, whatever it is, and we have multiple ones of these, then our energy is like this. And so to get that expansion through craniosacral or Reiki or polarity therapy or any of those things is sort of an opening. So sometimes when we have those openings, sometimes there's things in the mind where we think, okay, yes, I'm more willing to do the gluten-free diet where they weren't before. So sometimes I like to do body work initially because it just has this, it opens our energy in many, many facets, if that makes sense.
Yep. Right. Very much so. Very much so. Yeah. And I find like we'll use a lot of times elimination protocols. Mm-hmm. And aside from food as an elimination protocol, we also do like social media and news and, any TV and screen time, right? Because sometimes that gives us more physiologically than the food. So it's absolutely amazing when we can get that eliminated from what, because it often compromises not only their gut and that gut-brain axis and their nervous system, but also it affects their sleep. And we have people that complain of insomnia. And, I'm like, you know what, just an hour. We need an hour of screen-free time before you go to bed. When the kids were small, they had a bedtime routine, right? They ate dinner, they played, we clean up, we take a bath, and then you read a book, and then you go to bed. And I find like a lot of people do not have that nighttime routine, and they suffer with insomnia. They suffer with many sleep issues. So if you can talk to that and what you see in your practice and how you get that managed.
Yeah, that's really a hard one, especially now as, we are so focused. People are so focused on the screens. And then we had, the perfect storm for that when we had during the pandemic was we depended on that. My business went like this, I was on Zoom calls all of a sudden when I had never been on a Zoom call before that time, so just things changed very quickly and they're addictive. There's an addictive quality to it. So, it takes discipline and for any age, you see, and and I work with a lot of people. Most people I work with have some level of anxiety, or like I said, the nervous system needs a break. And so for somebody that has anxiety, every time if they hear their phone, buzz or beep, or, all the different binging, all the different things, yes. And then and you can almost see them physically, like they have to check that, so they're always attached to it. And it's a very ungrounded way of being. And, if you want to, and that's like an earth element as a Chinese type of a term, but if you're ungrounded, if you're up in the ethers on, the internet and stuff, it's very, the energy's up here. It's not down where things make more sense per se. Like it's more like almost like imaginary, if that makes sense. And so, yeah, so I do I suggest lifestyle things like you're saying. Like, I love that. During the pandemic, I told so many people, I'm like, turn the TV off.
Mm-hmm.
Nothing's changed. Turn the TV off. You already know, you have your mask, you got your vaccination or you didn't, and that was your choice. And now if you have to go to the grocery store, get your food and, and have it delivered or whatever you're going to do. But, I think people were just so glued to the TV, and it was a horrible thing, because that was what they would constantly, did you see the latest? And I would say, no, I didn't.
Right.
And I'm lucky enough. I live within walking distance of my job. So I don't even have to know if it's snowing to know if I need to cancel anything the next day. If people can make it to my office, I'm there. So, despite the weather. So I'm a bit spoiled like that, but I'm so much happier not watching the news. I actually stopped for a long time years ago. I think it was in 2012 when there was the school shooting up in Massachusetts, Connecticut. And I was much happier when I stopped watching the news. I thought, you know what? Yeah, it's not conducive to happiness or peace, basically. So
Agreed.
yes, definitely turning those things off. And then and then some people say, well, we need to know what's going on. Okay, so watch 10 minutes. And then I always say, I think the local news is a bit better. It's not, it tells you the things that are happening. You'll find out some world news too, but you won't get so much argument and, opinion and that kind of stuff. And so that's what I'll tell people if they want to stay informed, or I feel like a newspaper is sometimes, okay, that was enough. I can put it down. But sometimes, you know what I mean? It's just so invasive if it's on the screen, I think somehow.
Right.
So yes, I do that. And then also telling people to have good sleep hygiene, like you said. Yes, it sounds like, my kids had a similar nighttime regime. It seemed to take a while, but it certainly got them off to bed, and they stayed in bed after, I got them tucked in after their books and their, all of those things. And we really downplay the need for good sleep hygiene. And it's not something that has to cost a lot. I mean, it can involve a nice warm bath with essential oils or some candlelight, like reading a book, something like that. But all of these things can just bring your energy down and make you ready for sleep, which sleep and digestion are foundational to health. If you do not have one of them, just one in place, you're going to have symptoms. If you have both of them out of whack, not a good thing. So, sleep is so important. And that's another thing that I see, just so many people have issues with sleep also.
Sure. We see that quite a bit, and how a person wakes up as well sets the tone for the day. So I try to get my patients to look at what's called I think it's called the hatch alarm. It's not your phone, and it's not music, but it actually mimics the sunrise. So your room slowly becomes lit. And it's really, really cool, because that's how you're starting your day, as opposed to right away you're in this fight or flight mode because the music turns on and you're in a deep sleep.
Yes.
Everybody falls asleep deep between that 4 and 6, right? And then all of a sudden, this, because it goes off, it just slowly comes up like the sun rising. Because the closer we get to, our circadian rhythm aligned with the sunrise and sunset, always the better we are. So I find that when people get on the sunrise alarm clock deal, they do actually a lot better. So it's really a very cool thing.
No, that is really cool. And people, and the more sensitized people are, the more they will say, I need to wake up slowly in the morning. Like they know that about themselves. And I know for me, such a peaceful thing is to just, if you're waking up and you just watch the sun slowly rise, sort of like how you're, saying about the hatch alarm, it's slow. And that's really, we're supposed to enter the day. So yin becomes yang, but it's not like all of a sudden it's noontime. You
Right.
know, it's slowly the energy's building. And if you sit outside during the early morning hours, you'll see that slowly. You'll see one car come, and then
Right.
and then now there's three,
Right.
and now and that's how the slow building of that, and that's a more natural way than like what you said. Yeah, that horrendous alarm and jumping on the ground and getting started that way is
Right.
very offensive to the body, I think.
Right. Very offensive. And I always ask them, can we please take an hour before you look at your phone? Because when you look at when the phone goes off, there's nothing really there that you ever looked at that truly ever changed anything, right? So, when you're scrolling through your emails, when you're looking at your phone, the question you have to ask is, am I moving my health forward by doing this? Am I learning anything? Is this helping me anyway? Now, don't get me wrong. I love to look at, Instagram. I love watching the comedy bits and all that kind of stuff. It's great. Seeing what other practitioners are talking about, it's fine. But we have to have a limit, right? We can't go on for an hour, hour and a half, because it's just not healthy. So I always ask them in the morning hey, take an hour. You just don't need to pop on. There's nothing there that's going to change anything.
Mm-hmm.
So we always talk about it because everybody's anxiety and depression, it's increasing. We're seeing it in the kids, teenagers, adults, seniors. And listen, we've been through a lot over these last few years. So I don't think we can have this conversation as colleagues and not touch on the fact that people are still suffering with the effects of COVID, period.
Mm-hmm.
Plain and simple, right? I have patients who have long COVID who we are treating. So in your practice, when you see this long COVID patient come in, still having problems breathing, still can't catch your breath, they're having problems walking upstairs, their joints ache, they got brain fog up the wazoo. When you're seeing this, what are you doing with them?
So it's contingent upon each one, because each of those things that you mentioned is a different organ system that so when somebody says, that they're getting winded walking up the stairs, then I'm treating kidney adrenals. I know it sounds like, what about the lungs? But we say the kidney adrenals have your life force energy, which sends it upwards for the chi, the energy for the lungs to capture, and then gives us that energy to go up the stairs. So and of course I would be looking at their tongue and their pulses for confirmation on these things, but just listening to what you're saying. Issues with the joints, we're treating liver. So, it's various ones that would be good for this particular person, to move that liver energy. And then also some support on, if it's pain, we can do some pain management for them as well. But we want to get to the bottom of it. Pain management I want to do that today for you, but I also want to take it away so you don't have it in the future. Ideally, get to the root of what's the driver of the pain. So supporting with herbs and lifestyle suggestions. And for each organ system, there's an emotion. So if liver, if we're seeing things going on with the joints as a result of long COVID, then we're addressing, or headaches. I've seen a lot of that, like migraines and headaches post-COVID. So addressing, and that's also liver stuckness. So not only addressing, some foods and herbs we can get in place, but what is the emotion that's housed in the liver? Anger. So we sift through that. I have exercises that I work on with people about that. It could be old stuff, or it could be new stuff. It could be all of the above.
Gotcha. So when you look at somebody that has that anxiety, that depression, so you're looking at an organ that may not be functioning at its best. But doesn't cognitive therapy also play a role?
Yes, definitely. Well, because number one, so when somebody gets something out that if they have something that's bothering them, so any kind of therapies where we can, some people move their energy by, manipulate. Chiropractic is one way of moving someone's energy, right? We can move it during body work. It's a more subtle, like lighter kind of work in craniosacral. Some people go out running and they move their energy, or exercise, any way of moving things. And CBT can move energy as well, because just, and talking in a session, that moves energy. It gets a piece out that was formerly inside. So all of those different things, I always look at, when we have stucknesses, depression it's a stuckness in the body. And more times than not, there are several root causes for depression. We could have a GI-based depression, but liver stuckness is most often the case. So we're dealing with the liver issues and getting out those things that we're angry about, right? Because that's what's housed in the liver from a Chinese medicine perspective, is important. And sometimes people aren't even realizing, because, we go around trying to be nice all the time, that we don't even realize that we can talk about our anger in an assertive way. It's not a negative emotion at all. So we think right away, no, I'm not angry. But anger is an appropriate emotion, and it should be expressed appropriately. The problem is that we usually see anger expressed inappropriately, and therefore we view it as a negative emotion instead of something that we need to deal with when it arises. Definitely not, be violent or screaming and loud, but if we do it assertively, and then if we repress it, that's where we see the depressions come in, and the fibromyalgia and things like that. Pain in the body, migraines, is a lot of stuck anger.
Interesting. And you talked about energy. So can you touch base on polarity therapy and what that is and how you use it in your practice?
Sure. So when I talked a lot about the body work, so I combine 3 different modalities. Polarity therapy is one of them in the body work room. And that is balancing the different poles of the body. So the different charges. So negative, positive, and neutral. And so we're going, and I know where all the different ones meet up in the body, and what I have to listen. There's a lot of deep listening that goes on, the language of the person. But then when I get to the body, the person's body, I can feel where the stagnations are. And they usually, oh yeah, I feel that feels warm there, or whatever. And then, so that's a balancing. Whereas the craniosacral is more about deep things that are housed in the nervous system. And so we combine those 2 together, and then Reiki is, universal life force. And we can really have some unraveling of things that we might have housed inside of us that we're unaware of, which that's the thing that's really cool. Sometimes, when we're in talk therapy, we know, okay, this was traumatic to me, but we may not have the language or memories around something. Say my entrance to the world was stressful, or, say I almost died as an infant coming here. My body will have a trauma response that it remembers. And so my adrenaline was very high at that moment when I was a baby. And so when I get into other situations, maybe that person might be claustrophobic or whatever that is, and we can't explain it. Sometimes it's those early trauma memories, and body work can help get rid of those things without us needing to have an active memory, a conscious memory. We can just shed that when I get on the different points of the body.
Gotcha. So you'd answered one of the questions earlier on about the fact that you can help with somebody who's having chemo under side effects. My next question is, and you're talking about anger and you're talking about the liver, those who have PTSD, is it usually, do you see it's the liver that's not working functionally in a PTSD setting?
Yeah, PTSD. And actually, so now I'm going to get a little more complicated. So the lung system, a lot is there. So there's 5 organ systems. So we have 5 elements, right, in Chinese medicine, like my business. And so the lungs house grief, and the large intestine is in charge of letting go what we don't need. Now, the lungs, and the reason I'm going to connect this to the liver. So the lungs house grief. One of the cycles of grief is anger. So one of the stages, rather. So it's sort of where there's that system within a system. So I have to listen and hear if someone is not okay with the ending of something, which in a PTSD case, that is true, because there's some angst they have still, and they still will view the world as an unsafe place. And so the idea of being able to let go of those experiences and subsequent mindsets because of those experiences is essential in order for us to have the liver be healthy, or the lungs. But I'm treating the lungs in that case. And then I do a lot with, we go down to what we call core language and what the person is afraid of. And they might just say, I'm always afraid that there's someone chasing me, or whatever that looks like. Or, all dogs are unsafe. But it's, once we get rid of that, once we process through that experience in the body, then we can then go forward in a new way. And we have shed those old belief systems. We now realize that, no, people aren't chasing me here today. So but we have to process through all of those stages fully till we get to the acceptance phase of the grief cycle. If that's making sense. I'm sorry if there's too much theory there.
Perfectly makes sense. So, you're still going back to looking at that person as a whole, right? What they've
Hmm.
been through.
Hmm.
I mean, how you can optimize their health, and that's
Yes.
really important. So in my world, when somebody comes to me, they say, well, the chiropractor I saw last time, he never did any of the work that you're doing, right? So he, maybe because there's so many different techniques that we have in the chiropractic world. And I focus a lot on manual myofascial release because I like that body work, the soft tissue work, rehabilitation, a lot with the functional medicine, working on the gastrointestinal distress. Um, so when somebody comes to me, it looks different than if they went to another chiropractor. So given your background as a master herbalist, if somebody comes to you, is it going to be different if they go to somebody else? If they look at the other people that went to your school, is everyone going to have that same thought process? I mean, conventional medicine, we're going to write you an antibiotic, and the next doctor going to write an antibiotic, the next doctor going to write an antibiotic. So, there's kind of like everyone's kind of like the same. So is that like if they looked at you and went to somebody else in your class, would it have been something different? Or does it kind of looked at the same?
No, I think everyone is the sum of all of their past professions and all, they're bringing all of that
Sure.
knowledge. Because it's interesting, when I was studying family systems therapy, there was a physicist in our class, and he's like, well, I'm not a physicist in this room. To which our instructor said, well, you most definitely are. And you're bringing that here, so we are the sum of all of our trainings and our family experience, our life experience. So no, my programs are very unique because I've studied so many different areas. And I also, coming from a Chinese medicine background, it makes me unique also because we are, like I said, we're looking at the root cause. I'm not just looking, the diagnosis is interesting and we want to do something with that, but I'm really interested in the driver of the diagnosis. That's who I want to eradicate, so that then the diagnosis is eradicated. But because we can just, okay, yeah, now we don't have headaches as much, but we still have them. Okay, well, where are they? What's the driver? Well, let's look. Where are they? Is it stomach? Is it liver? Is it gallbladder? Is it liver? Where it comes through the eyes, it's liver. So all of these things mean something different. So then we can treat the headache, but then we can also say, okay, we have some stuck anger here. And if they're not aware of it, then I'll talk with them. Because that's the stuff early on in my practice that people, you have some people that are like, just tell me what to eat. And they don't want to look at those things. And I'm like, you have fibromyalgia, you have there's deep stuck anger here. We need to sift through that. But when things are stuck and so deep, oftentimes there's been a message, it's not safe to talk about it. So then they buried it so deeply. So it takes, some work and trust. And they, they have to gain trust in me also, and know that it's a safe place for us to work on those things at the office. But it can be done. So my practice probably is far different than anybody really that I went to herbal school with, because I have all of these other modalities that I bring in. And it's just like, I just like to think of them as languages, and we talked a lot about the thyroid, but it's right here.
Mm-hmm.
And so oftentimes I'm talking about, that there's a chakra that's here. So that, it's the fifth chakra, and it's about expression and voice. And so a lot of times I'm talking with people about that. And we are trying to get rid of blockages, in addition to talking about, the stuck anger and the stuck whatever else they're talking about. So there's so many things. I guess the key is to be just an avid, interested listener and stay open. And the more open that they sense from me, the more they'll tell me. And that's where the medicine really is too, I think, in, knowing all of their beautiful story.
Gotcha. We're coming to the top hour, but I still have a few more questions. So are you willing to hang
Sure.
with me a little bit more?
Yes,
Okay.
I am. Mm-hmm.
So, family systems, can we talk about that? I think that's really important.
Sure. So I used to conduct this in groups. I used to facilitate groups, which is really amazing. And then I'm going to start them again now soon. I think it's safe at this point, but I do them individually as well. So what this is we get to look at situations in a very experiential way. So when I'm doing just one-on-one, if you were in my office, I'd be breaking out my little dolls and showing you. So I have little dolls that represent people or things in somebody's life. So I would say, what would you like to take a look at? Well, I want to take a look at, why I have thyroid disorder. We can look at that. Or I want to take a look at why I can't finish projects. or, I want to take a look at my relationship with my mother. Any of those things are fine. And then we get out the little dolls to represent them. And then it takes on a life of its own. But the easiest one, if you say, I want to look at my relationship with my mother, and I put two dolls next to each other and they say, can mom, the doll be off the table? They don't want to be close to her. Then basically I'll say, but you said you would like to improve this relationship. What can we put behind you and behind mom as supports that now we can look at each other and start to sift through what has gone on in the past? And so then we might look and we might see, oh, the reason you don't want to be near mom is you're housing anger because of this or that's happened. And then so we have dialogue between the two. And then it's being able to look at the situation with new eyes. And so then we don't house the anger, the sadness, or we don't take on things that are really other people's work or other people's trauma. And so this is where, unhealthy patterns, when they've gotten handed down through the family system, this is where we stop them going forward.
Gotcha. And that's an additional certification, all the other certifications.
Yes.
Yes. Wow. Yeah. That's fantastic. You can see where that helps. And my next question is, you are a beet cancer supporter counselor, right? Can you talk about that a little bit? Yes.
So I took this certification back when I had been out. I'm trained by Gerson Institute as well. So after I studied at Gerson, I came upon this, and it was actually local. It was down the main line in the Philly area. And what was so unique and what I really enjoyed about this certification, or the woman that began everything, was it's very much a sitting and listening to the patient about, where do you think the imbalances occurred? And they get to talk a lot about their story, and then how it's also help for the family supporting, so that the family can help support the patient. But it's very much about root cause once again. And, how can we get rid of the acidity on that level? So, and where is it? Is it diet that we need to improve, or is there stress in the home, or a job, or something like that? Like what needs to change? So it's supporting at the root cause once again.
That's fantastic. That's great. So one more question. What is the book you're reading right now? What book are you reading right now?
What 3 books am I reading right now?
So me as well.
Okay. And that's I probably have 5 started, but I put 2 away because I have one that just came in the mail. It was the something of belief, the science of belief.
Okay.
The other one is called Being Supernatural by Dr. I'm trying to think of the name. It's right over on my coffee table, but or Becoming Supernatural. And that one explains like the work that I do. It's sort of the sciencey end of it. Like when people say, oh, that's woo woo, that, you can go, work on somebody and then, their cancer is resolved, right, or, getting better, or whatever that is. And it explains it from a scientific perspective, which I love it when we can do that. That's a beautiful thing. And then the one that I listened to twice, and I bought the hardcover book, and it's beautiful, and I recommend anyone buy it, is Brene Brown's. It's her Atlas of the Heart. Gotcha. And I listened to it twice. The reason is because there's so many nuggets. And when I listen to a book, a lot of times I might be like organizing in my office or washing the dishes. Is another place, taking a bath. And I'll be like, oh, that's so good. That's so good. I need the hard copy so I can, highlight it. And I decided I want to do a book discussion group on that one, because what that one is it has, it goes over human emotions, and it categorizes them in like groupings, and then it differentiates. So I think if we can fine tune and realize what we're thinking and what we're really experiencing, it can help shape our actions and make them healthier. So and then the Empath Survival Guide, I was reading through a little bit. I did a book club on that a couple years ago, but I wanted to refresh a couple of pieces from that. So those are the 4 that I have open right now.
All right. Those are all fantastic. Oh, great.
Yes.
Very cool. So thank you very much for spending time with me tonight. Can you share with everybody, how do they get in touch with you? How can they start working with you? Sure.
Thank you. So they can get in touch with me either by calling my office number, which is 215-738 888-778-0751, or check out my website. It's 5elementsholistic.health.com. And right in there, there's a place where you can contact me if you want to schedule a consultation, if you have any questions about any aspects of my work or what I might think would be a good fit for you. And I do work with people all over the country, this way on Zoom or in the office. So yeah, we'd love to hear from anybody if it sounds like we would be a good fit. And thank you very much. Thank you for having me, Dr. Kaye. It was really wonderful to be here. Thank you.
This is great. Thank you. I absolutely learned a lot. So everybody, thank you very much for watching. And a copy of this will be up on our YouTube channel. And we'll speak to you soon.
Thanks very much.
Thanks.
Bye-bye.